Right. Yeah, there's an admit all option there.
Yeah. Admit everyone. Hi, everyone, and welcome. We're just waiting for people to join from the lobby. And yeah, we are live, and hopefully we are recording as well. Brilliant. Hopefully the pings aren't too off-putting. I can't find a way to mute them. All right. Okay. So hello, everyone. My name is Anne-Marie Blake, co-founder of True. I'm joined by my co-presenter today, Russell Cartwright, and I'm not going to go into our CVs. You can look at our bios on the either LinkedIn or the joining instructions. That will take far too long. But yeah, safe to say that a kind of chance meeting with Russell actually has led to this webinar. So I've known Russell a little while. We often have a coffee together in Costa Bromley for anyone that's interested. And we started talking about behavioural science, because I know Russell was doing a lot of work in that area. And, we asked the question, why we weren't seeing more of it within internal comms and change, because we know that it's evidence-based and we know that it works. And so we said, well, let's do a webinar on it, because I think more people would be interested in finding out more about it. And 200 people registered. So I think we're definitely onto something there, kind of, Russell. Okay, so how this is going to work, we've got kind of people from public, private sector, and we've got independents, and we've also got people that submitted things that they wanted us to cover in advance. So thank you very much for that. So how it's going to work, I'm just going to kick off a little bit, building the case really for why we need to look at behavioural science, and a little bit of a look at kind of what change is doing for us today. And then I'm going to hand over to Russell, who's going to take us through kind of his experience, some examples and top tips that you can take away. And then we will allow enough time for questions. So, we want to maybe kind of finish the formal bit of the presentation in about 45 minutes to allow enough time for questions. So for those of you who are not familiar with kind of Teams, there should be a Q&A box, which I've enabled. So if you try and put your questions into the Q&A box rather than the chat, it just means that we're able to follow it a little bit more easier. So without further ado, I will kick off. All right. Okay. So if you've ever been to any presentation on change or read any thought leadership on change, you will probably have come across this number, and this number is something that's sometimes misrepresented. I went down a bit of a rabbit hole once trying to kind of figure out whether McKinsey actually did say this, but the way that we use it is that 70% of change programs do not deliver their expected benefits, and that has been kind of reinforced. The numbers may well change, but they are on the 70 to 80% range by other researchers. So EY have done some stuff on it, Deloitte, etc., about not delivering their expected benefits, which is okay, it's a data point. But I think the bit that's more interesting is that the reason that they don't deliver their expected benefits is because of human factors. So we probably talk about things like employee resistance and change fatigue. And one of the reasons that Howard, my co-founder, and I set up True 3 years ago was, we believe that there is a better way to do change, and what we need to do is make sure that we have people at the heart of it. So I have been doing change for probably a couple of decades now. I've done everything from buying companies, selling companies, transformation, tech-enabled change, and kind of the dreaded desk move. And with all of those things, they're more likely to be successful if we put people at the heart of it, rather than kind of trying to guess or build a bigger poster, because ultimately you can have the biggest poster in the world, the best designed vision in the world, but unless employees and leaders adopt the required behaviours, then your transformation, of course, is going to not achieve its benefits. So I'm just wondering whether this sounds familiar to anyone. So, the strategy is clear. We've done the comms, we've done the trainings, and yet there's still resistance. I remember a few years ago, I worked on a I came into a big transformation. I was taking over from the comms lead there, and it cost them millions, and there were lots and lots of benefits from this particular tech upgrade, and they still found people using the spreadsheets, the Excel spreadsheets, and uploading them into the system. So as you can imagine, that wasn't an optimal situation. And I think kind of where we've come to in terms of change is that we rely on models, so ADCAR. I'm not going to mention the change curve because I'm not a particular fan of it, but Lewin's model, for example, and all of those, I mean, they're reasonable enough models. I'm familiar with all of them, but what they do is they they're built on the premise that change is done to people, and by raising awareness, for example, or getting people to understand, then actually adoption will occur. And we know that that's not necessarily the case. And the reasons for that are many. And someone whose work I do draw on quite a lot is Hilary Scarlett. She's done a lot of work in the neuroscience field, but also I'm going to mispronounce his name, so apologies, Daniel Kahneman, who has written Thinking Fast and Slow. And part of the hypothesis of that book is that our brains do a lot of work every single day. I think they have to make something like 35,000 decisions, which is about one every 2 seconds, I think, if my math is serving me right. So from what to wear, what to have for breakfast, etc. And so if you imagine that most of what we do is intuition and instinct, if we spent our time doing rational thinking for every single thing that we did, our brains would be exhausted by the time that we walked to the shower. So what behavioural science does, it actually kind of thinks about kind of habits and actually kind of why people do what they do. And that's really kind of what kind of Russell is going to kind of talk us through today. And, as you listen to it and listen to the examples, kind of have a think about, whether you can apply the concepts that Russell was going to be talking about into some of the change that you're going to be working on, because as I've said before, it's never going to be one size fits all. It's about having an understanding and an appreciation of kind of the science. And we've got 40 odd minutes to do this. This is only going to be kind of a high level overview, and when we get to the end, we'll talk about some other things that we can help you with if you want to go a little bit deeper. So Russell, I'm going to stop sharing and allow you to hopefully present your slides.
Thanks, Anne-Marie. Yeah, just loading up actually, which it's good to see lots of familiar faces and new faces on this while it's loading up. Yeah, here we go. That's good. Okay, so just building on what Anne-Marie said, when organisations go through change processes, they often fail to see the importance of managing kind of working behaviour through the change. The focus can quite often be on the design of the working environment and the IT within it. And there are kind of three key levers identified by behaviour change academics for organisational change, and those are bricks, bites, and behaviours. And typically not enough effort is put into the behaviours. We think about, the environment, or if we're changing buildings or moving people around and things like that. And we think about the IT solutions or digital solutions, but often not really enough about the behaviours. And sometimes our default can be, more communication, more information, more emails, more posters, like Anne-Marie was saying. But really done well, internal communications and engagement can be a massive enabler to shifting people's working behaviours and their attitudes. So yeah, like I said, we need to shift that focus to the behaviours and to use two-way communication and empower. I really do think that the middle managers really do need to play an important role in the organisational change. So yeah, just moving on. Why behavioural science? So I've been working in communications for more than 25 years, approaching 30, and in the last sort of 6 or 7 years, I've become interested in behavior change and behavioral science, and it has very much changed my outlook in kind of how I do things. I've done a lot of work in public health in that time, and I've really used these to deliver real outcomes and real noticeable changes. So why do we use behavioral science? So really, it's about understand in a nutshell, it's about understanding how people make decisions and what motivates them either consciously or subconsciously to make those decisions. What around them, not just within themselves, affects whether or not they make those choices. And how we can use things like framing or some other techniques that we're going to look at today to kind of encourage them and change their behaviors. And really, awareness isn't a behavior. It's often not enough. Engaging with content isn't enough. Guessing what works can be expensive and not work. And I've been able to see that you can deliver communications that actually make these real changes, like I say. So yeah, I use it to understand different parts of our audience, to analyze what's stopping people from making the change or making the behavior that we want to do, and try and help make that decision making easier for them to get them to move from intent to action. Behavioural science has been applied in a range of fields: health and safety, environmental sustainability, finance, crime, public policy, business, marketing, and education. There are examples of good internal use, but as Anne-Marie said at the start, there's less evidence of that, and we do really think there is real potential there for it. So behavioural science, as I said, is all about using evidence-based behaviour change interventions, and not something called ISLAGIAT, which is not the most catchy of acronyms, but it is something that I know I've been guilty of in the past. So ISLAGIAT stands for "it seemed like a good idea at the time." And we've all done it. We've all done it because we think it's going to work, or because somebody tells us it's going to work, or it worked before, or so yeah. But we can't rely on it, and yeah. So we need to draw on that evidence. Another reason why I became passionate about behavioural science really was to avoid moments like this on the screen, which anyone who worked with me in the early days of my career will have seen me in a meeting. Maybe at the end of the meeting, I'll be put on the spot and asked for the comms solution to a problem. And I would go bright red. I would panic. I would go bright red. I'm a reflector. I need 5 minutes to think through my answer. And actually, that since I got into behavior change, behavioral science, my outlook on that has completely changed. I'm confident now that despite all of my experience, I don't have all the answers. But with a mixture of good solid theory and some testing in real life situations, we can always find good solutions. So this example I'm going to give now is a public health public campaign around vaccinations. It is of its place, but I'm going to take you back to June 2021. It had just been announced that young adults, 18 to 39-year-olds, were going to be offered the COVID vaccine. For me, it's a great example of going through the behaviour change processes at pace, as we turned this campaign around really quickly in just over a week, including research. And the research showed us that the vaccine was a hard sell to young people, young adults. That they'd arguably given up the most during the COVID pandemic. Those parties, gigs, university years, what should have been some of the best years of their life. There was complacency. They were told when the vaccines first came out that they didn't need it. There was confusion from the start of the pandemic. They'd been told they were low risk, and they'd had to give up so much for the benefit of others. And there was also high levels of distrust in government and institutions from this group, feelings that the pandemic had been mishandled. So as part of that, we created a kind of energetic visual identity that connected with their target audiences and kind of rose above all of the noise of the other public health messaging that was going on at the time. And we developed this campaign, Over 18, Don't Miss Your Vaccine, delivered with a positive frame, empowering young people to make the right decision and the right choice for them. And crucially, using the concept of freedom and repositioning vaccinations from a kind of threat to personal freedom to more of a proactive, positive choice to step back into the old normal, as people were people were talking at those times, harnessing the power of personal benefits to incentivize and motivate them to access their vaccine quickly. There was a really simple call to action, which is key as well, and they were able to book a vaccine very simply via a standalone kind of landing page. I'm just going to show you a quick 30-second film, which will illustrate. Oh, sorry, hang on. I've done that wrong. 1 second. Here we go.
For my mates down the pub, for dancing in the club, for the long-awaited embraces, for not fearing tight spaces, for gigs and mosh pits and Wellington boots, for fewer video calls and you're still on mute, for that well-deserved time on the beach, for enduring the awful best man speech, for seeing the back of unprecedented, for the old normal and back to being truly connected. Whoever it's for, whatever it's for. If you're over 18, don't miss your vaccine. Find out more at nhsselvax.com.
Sorry, just getting back to my other share. Yeah, so that film was really powerful, and it absolutely did extremely well. It was licensed for use across England. Campaigns came out, like national campaigns came out that were very similar, and we took that as flattery. But we ran that video and we ran other adverts using the campaign, and we had impressive results and big numbers. And this was these high numbers. We smashed all of our targets. However, these would be meaningless without the next slide, which is all about the impact it made on getting jabs in young people's arms, basically. So this is where I really saw the value of using behavioural science for communication to drive people to take actions. So within the first few weeks of starting that campaign, we saw a massive increase in particularly 18 to 29-year-olds, big increase in 30 to 39-year-olds, and we basically had a kickstart. Our adoption amongst this group was much higher than the rest of England and the rest of London for the start, and also crucially, the global majority ethnicity rates increased faster than those of white ethnicity following the campaign. So it was really positive. And it, like I say, it was copied, it won multiple awards, but the key thing for me was that I saw the value of the approach. So one of the things that's really important when it comes to using behavior change is actually being clear about what we're trying to change, what is our behavior, and it's not as straightforward and not as cut and dry as you can think. So on the screen there are seven different possible behaviors. I'd like to give you just 30 seconds just to have a quick look at them and work out which ones you think are a behavior. Feels like we should have the countdown thing on.
I was thinking we need to add music to this timer, don't we?
Yeah.
Absolutely.
Next time. Okay, hopefully you've given that some thought. So smoking is a behavior, although smoking is a complicated behavior because it's also a habit and it's also an addiction. However, those are, you could say, those are the outcomes of smoking. They're the outcomes of the behavior itself. Injury at work, so that's an outcome. It may be an outcome of a particular behavior, but it's definitely an outcome. Similarly, as is work-related stress. Taking regular breaks from computer-based activity. So yeah, that's a behavior. And actually that's a really good one for internal comms and a good one for changing. There's real good opportunity to change that behavior and make a real positive difference. Attending a cancer screening appointment, again, that's a behavior. Booking a cancer screening appointment, again, that's a behavior, and they are both separate behaviors. So it's important to think in those ways when it comes to what it is you're trying to change. And then retaining staff. So again, that would be an outcome. It may be an outcome of several behaviors, but that's an outcome. Okay. So as I mentioned, really important first step is to define the behavior that you're trying to change and base your research and what it is you do around trying to change that behavior itself. I'm not going to talk a lot about this, but research and insight phase is where you really get the value of this approach. It's where, if you don't do this, it's really hard to understand what's driving and what's stopping your behaviors from happening. That said, just doing a little bit of research and insight is better than doing none. But the more time and effort you can invest into this, then the better results that you're likely to get. And thinking about things like how you'll measure it, what data you need to measure it. One key tip is find out who holds the data that's going to be able to do that, and make friends with them, get them on board with the project, and it will make your life so much easier. So the COM-B framework, and I could talk about this for hours, but there's not time, so I'm just going to give you a really quick overview. And basically, you see we've got the 4 boxes there on the right hand side. You would normally put in the behavior that you're targeting, and I like to describe the 3 things on the left, so capability, opportunity, and motivation, as 3 windows which all need to be open at the same time for your behavior to happen. And I think this is really important when it comes to internal communications and change. Motivation isn't enough, and information on its own isn't enough. There are all these different things that can impact whether you do something. We talk a lot in behavioural science and behaviour change around something called the intention to action gap, and that's something we will have all experienced. We've all plans to go to the gym 4 times a week, and not life has got in the way and it's not happened, or plan to eat 5 fruit and veg a day, and for whatever reason somebody gives you a donut or whatever in work, and it doesn't happen. And so what COM-B does is it pulls together evidence from a wide range of behavior change theories and techniques, and it takes account of the person and, very importantly, their environment around them, so the people and environmental aspects that influence whether or not they carry out the action that you're after, the behavior that you're trying to influence. So to use COM-B, typically, and if you come to one of our sessions, which we're going to talk a little bit later about, you will get a chance to do this, but I would use these questions on the right hand side to basically ask those questions of some data. So maybe some free text, what we call small Q qualitative survey results, for instance. And what I would do is go through using these questions, code, group, and then kind of theme the data, and from there you get a better understanding of what the key elements are. And I will give an example of this in a minute, which will make it a little bit clearer. But just while we're talking about that kind of analysing using COM-B, so you can use AI to help with this. It can help speed things up. So large language models, I've used a few, Google Notebook, I've used Claude, that they can all be very helpful when you have a lot of qualitative data to analyze and theme. Can save you quite a lot of time, but you can't rely on their outputs. So you do need to be very familiar with the data to avoid any hallucinations. The themes won't always be right. They might give you a decent start of a 10, but they certainly won't do it all for you. And also be really careful not to share any confidential data or data that names any places with these, and follow your organization's policy on using AI, which I hope most organizations have by now. So that's a quick intro to COM-B. Here's an example of where an organisation has used it. So one London NHS trust, hand hygiene compliance was a patient safety priority. This will probably resonate with a lot of you who maybe work in health and safety, or have behaviours like this where you need to try and influence them. And they set an objective of a study to co-design a behavioural science informed intervention to improve hand hygiene compliance within the hospital. And they carried out 18 hours of observation of staff behaviours on 3 wards. And from there, they were able to map things against the COM-B, basically. So they were really targeting overall compliance for hand hygiene and what's classed as moment 1, which is right before touching a patient. Yeah. So people found it hard because it's a fast-paced environment, busy. They were often switching between tasks. Some were confused about when or if they should be using gloves, and there were no kind of timely cues as to when to do what, or no prompts at the right time. So when they took that insight and mapped it against COM-B, they found that in terms of capability, generally staff knew how to wash their hands. They forget, as I mentioned, when they're switching between roles, and some people thought the gloves were doing the job for them, or that they gave them false confidence. In terms of motivation, the staff generally wanted to do the right thing, but different habits and different norms meant that practice varied. But what they identified was the real barrier, and the real area that they needed to target was opportunity. So as I said, there were no prompts at the real time when they were needed. They're in a busy, high pressure environment, and the way that the rooms and the wards were laid out, and the way that all the equipment was laid out, there was kind of friction, other things getting in the way of them making the right decision. So what they did was they did 3 very simple visual prompts placed at the key points identified from that observation where hand hygiene was failing. So on computers on wheels, on glove boxes, and on patient bedsides, they put these stickers. And it works because it reduces the cognitive load, as we call it. It gives you less to think about. It gives you a really timely cue. And it reinforces that hand hygiene is the norm. And also, I think, and again, this is really useful for internal comms and change, the solutions, the intervention, as we'd call it, was co-designed with staff. So staff worked together with the communicators to develop that. And in terms of the impact, so excellent results. Their overall compliance for hand hygiene increased after 6 weeks by 11%. and 15% increase in compliance for that moment one, which was the crucial just before you touch the patient thing. So you know, that's just a fairly simple example, which does show the value of this of the approach. And again, I just re-emphasize: don't start with your messaging. Start with the behaviour. You know, diagnose what the real barrier is, because that informs your behaviour. Yeah, fix the environment to address that intention action gap. Use timely cues rather than throwing more and more information at people. Get them at the right time, and co-design with the people doing the behavior. Small changes. This is a small change, you know, a few stickers put in the right place, they really created a significant and measurable impact. So moving us on. So just a few, there are lots of these, and again, I could talk about these for forever, but I haven't got the time today. But just some principles that you could apply. So defaults, we know that people stick with the default option. So if you tell people to opt out of the pension scheme, then they're more likely to be in the pension scheme than if you tell them to opt in, or, you know, things like that. People are very much influenced by what others are doing, especially other people like them. And, you know, you can easily add social proof, or things that make what you want to happen a social norm to your internal comms, to your subject lines, to your article headlines, to, you know, to the content itself. The way that framing, the way that information is presented really affects decisions, and really affects what decisions people make. Salience is really important. So making your key information visually and emotionally engaging, get people's attention, and, you know, in a positive way. Loss aversion is another key one as well. The pain of losing something is more than the pleasure of gaining something of an equivalent amount. Which again is interesting and can be applied. So just some examples of using this. This is a letter that was sent by the Department of Health, working with the Behavioural Insights team. It used to be called the Nudge Unit, or used to be known as the Nudge Unit, to basically try and cut down on overprescribing of antibiotics, which is a problem for all of us. But because they don't work as well when they're overprescribed. And what they did was they used a social opportunity. So they positioned the GPs who overprescribe as outliers by saying that the great majority, 80% of practices in England, prescribe fewer antibiotics per head than yours. So straight away you're you know, positioning them as an outlier, using positive messaging around the others who are doing it well, but putting you outside of that group. They use social opportunity by using an influential messenger, so the chief medical officer for England, and a physical opportunity. So included in the letter was a leaflet that the GP could give to patients who, you know, booked an appointment hoping to get antibiotics. And that very simple intervention prevented 73,000 prescriptions during a trial period over 6 months, which is again a massive saving in terms of money and in terms of overprescribing. This also demonstrates the value of testing things and tweaking. So this letter has been tweaked several times since, and some changes have led to more prescribing and some have led to less prescribing, and until you do some of that and make sure you've got everything in place to measure it, then, you know, you can really learn and optimize what you do. So social proof, people are influenced by what others are doing. Lots of brands use social proof in their advertising. For years, Budweiser was promoted as America's favorite beer. Again, I think it was UK government, HMRC wrote to people saying that 9 out of 10 people pay their tax on time. I really like how Aperol use something called implied social proof, because they never actually told anyone it was popular. They never advertised how many cocktails or Aperol Spritz were sold. They've managed to create that impression rather than state it, and they've done that using distinctive, visible colour and look. Also, they've got their glasses everywhere, so it's very recognisable. Most spirits and drinks are colourless. Because Aperol is so distinctive, you notice people drink it, and it leads to something called distinctiveness phenomenon, which basically makes it memorable, but also creates an impression that it's more popular than it actually is. So, you might go somewhere and there's 100 people and 10 of them are drinking Aperol Spritz, and actually the evidence shows that you would massively overestimate the amount of people that were drinking Aperol Spritz because you noticed those that were. And again, distinctiveness phenomenon is something that you could apply to your change program. For instance, make the new behavior perceptually or socially distinctive. Make it impossible to confuse the old system or behavior with the new one. For example, at staff events, you could make early adopter teams very visible. You could get them to wear something bright and leery, or you could make a piece of equipment or a piece of software very, very distinctive, so it's clearly very different from its predecessor. EAST is a really, really helpful framework to use. It was developed by the Behavioural Insights team as a way of guiding design to take account of the more automatic decision-making processes. So the idea is that you can apply this, and you may not apply all four, or you may apply all four to whatever problem you're trying to solve. I think if you're going to take one thing to have a go at with behavior change, the EAST framework is a really good one to pick up. There's some good guidance from the Behavioural Insights team, and you don't need to put too much time in to be able to make it work. So the four areas. Easy is all about harnessing the defaults, as I said earlier. Make the desired behavior the only way to act. Reduce hassle and reduce friction. Get the choice architecture right and simplify your messages. Attract attention, so that salience point. Things that stand out visually and with the messaging. Social, demonstrate that most people do the desired behavior. Use the power of networks and encourage commitment to others. Timely, prompt people when they're most likely to be receptive, like those stickers on the hand washing thing earlier, but when it's most likely to work. So a really good example of this was in Qatar, where they had really good success promoting diabetes testing during Ramadan, and the reason for that is fasting is required for the test. So, if you can get people in front of, or, if you can have tests available for people when they're fasting already, uptake was really high. Also emphasize the immediate benefits. So with smoking, we tell people how much they'll save a week, or how their hair, teeth and skin will improve quickly if they stop. And also don't promote a service or an intervention or a change that won't happen for a while, or that doesn't have any capacity yet, because all you do then is create disappointment, and people forget about it anyway if you go too early with that. So I'm just going to quickly go through an example of using EAST. We were asked by some of the attendees today to look at how we could apply behavioural science to increase uptake of the staff survey. So I've had a go at this using EAST. For research and insight, I would have carried out some structured interviews. Probably no point doing a survey about why people aren't doing surveys. So I'd do some interviews. And here's a kind of semi-fictional challenge. Staff participation had plateaued. Operational and frontline teams underrepresented. Lacking in good data and insight, for the organisation to thrive. So some of the behavioural barriers that I identified would have been, low perceived value, nothing changes, we've done it for years, nothing's changed. Friction, so time, effort, access, those are all things, competing priorities, and a weak social norm, so no one else bothers, why should I? And then just thinking about mapping that onto the East framework. So again, make it easy, give people one-click access. If you've got lots of staff who don't use computers, give them a QR code so they can do it on their phone. Use messaging that it takes 5 minutes. Make it clear, make it short, attractive. You said we did examples, visually engaging comms, personalized messages from managers they relate to, and frame those benefits clearly. In terms of social, team level participation updates. So, how many in our team have done it, how many in so many teams is a good one. Leaders talking about it publicly and completing it. Peer-to-peer encouragement, and make it a social norm, as I said. And then for timely, get those prompts in at the right moment. Maybe aligned with shift patterns or whatever. Do a final nudge just before the survey closes, and maybe time it with some organizational milestones or something like that. So just in terms of how this is the kind of impact you could see from doing this, and there is evidence that shows that using East will reliably increase uptake in your surveys. So just from using social proof, you could see up to 5% increase in uptake. And if you can combine social proof with simplification and better timing, you could see up to 10% more uptake of your surveys. And Anne-Marie, you've experienced this with a client, haven't you?
Yes, rather randomly, my mind just went to Aperol Spritz, because on Friday I happened to be out. I'm like Leanne, I don't love Aperol Spritz. The first person ordered Aperol Spritz, the second person ordered Aperol Spritz. I wanted a red wine, but what did I order? An Aperol Spritz. So, social proof and all that. But no, on this, we were delivering some training to a manufacturing client of ours, and, they have a central comms team, but they also have people that aren't necessarily full-time communicators. They're doing it as part of their role, and have been kind of told basically that we've got this survey coming, we need more people to fill it out. We're not we're not seeing the response rates that we want to. And so I basically took her through the East framework and didn't really think anything more about it. And then the next time we had a kind of check-in, sadly we didn't measure it, but she said they'd seen the most responses to a survey that they ever had. So, I mean, I think that the kind of takeaway is there that it works, it's evidence-based, and you don't need lots of money to do it, and neither do you have to be a qualified behavioural scientist to apply the principles. So, maybe just one thing to do is look at something that you're doing. It might be something as simple as a survey, and have a go at it and see what kind of works for you. Sorry. Leanne went for mango, sorry.
Really good summary though, Anne-Marie, thank you. I'm going to be very quickly on this. So I think overconfidence that what we do will work is a key problem. Nudge units and the private sector understand this really well. It is much easier now for us to use data for experiments and tests to see what works best and learn. And completing a combi can help you identify some of the different behavioural frames that might drive people to take your desired behaviour, but you don't necessarily know that that it will drive that. And sometimes you might want to try different parts, or there may be a few things that come up with the combi, and you might want to test different ways of framing that messaging. And you could do that for different segments, people based in different locations, roles, teams, etc. I'm also a strong believer that focus groups have a good place for collecting insight, but not for testing creatives and messaging. The best way you can test them is in real life with a sizable sample of your actual audience, if possible anyway. Also, surveys can be a bit flawed because self-reporting, people often want to appear better than they are, or they see themselves through rose-tinted glasses. The best way is to actually test whether when people see your content, they do what you want them to do or not, if at all possible. And you know, there are some ways on this slide of things that you could test for with your internal and change comms that, you know, you could do some sort of A/B testing, or just test some different variables of content to really learn and optimize and maximize the impact of what you do. Again, there's not time to go into measurement and evaluation now, but I just do want to stress the importance of it. It is really important. Otherwise, you are just going. If you're not using evidence, you can never learn from what works and what doesn't work without doing this well. And there are some good frameworks that you can use that can help you do that. Again, I'm not going to go through these one by one, but somebody called Dr. B.J. Fogg did something really helpful, actually, which was to pull together several decades of research on behaviour change into these 10 short statements, which are now known as the Fogg maxims. But really, they're 10 reminders of things to pay attention to if you actually want to achieve behaviour change. And I'm not going to go through them, but it's a list that you've got. And if you're, working on change, it's always worth just having a look through this and just checking that you're not making any of these common mistakes, or if this can be helpful to push back if somebody is asking you to, make one of these mistakes. So yeah, that's just a helpful thing to refer back to. So that takes us on to questions. Now, my device has been buzzing, so I think there are questions, but I haven't had time to look at any of them. Anne-Marie, have you been looking? And
yes, I have. I think it's probably been buzzing with the Aperol chat, but we do have a question from Phil, which is around: do you have any tips to get data to measure behaviours before and after when staff work from home or where there's not an obvious metric? Oh, coming in with the exam questions here, Phil. So it would be interesting to hear how the hospital measure how often people wash their hands in your example. Are you happy with that question?
Yeah. So obviously, when it's in hospital, it's easier to observe and measure. So they basically on that study, they spent time observing and interviewing people, and then repeated it. It's harder to measure behaviours when people are at home. That's clear, but there are, especially with digital tools and digital implementations, it depends what the behaviour is you're trying to do, but you can track a lot of things if it's on a computer. You can also do things like have some interviews, etc. But the key thing really, I would say, is again, the interviews and stuff are really helpful for understanding what might be stopping people do it, but then the measurement is actually, are they actually doing it? And that's the key thing. Yeah, Anne-Marie, I don't know whether you wanted to add anything to that one.
No, I mean, I think, taking a bit of time to think about the behaviour that you want to observe is kind of how you're going to get the measurement, as opposed to the things that you're not going to be able to observe, if that makes sense. Because what you'll want to test is actually whether your communications or interventions are having the kind of appropriate impact as well. Hopefully that's answered your question, Phil. Cool. We don't have any more questions in the chat. So, thank you. Okay, we don't have any more questions in the chat. We do have a couple more questions, so do that. But one of the things that I wanted to kind of maybe speak to you about, Russell, was, there are things that we can do if you're a communicator or a people person, but when you're in the kind of workplace, you're not necessarily on an island on your own. So is there anything that we can get others to do to kind of support us as kind of we look to take a more kind of people-centered and behavioural approach to the way that we do our work? I'm just thinking we've got 15 odd changes going on in the workplace at once, and all that cognitive load, it's like really hard for people. And so the more that we can do to make it easier for people, I think the better. But sometimes we need to convince others as well.
Yeah. That's a really good question. I mean, I think it's really, you know, the communications team are really busy in most organizations. And it's a really easy mindset to, right, let's do something. And you'll write a really great article or a great piece of copy and things like that, and assume everyone's going to read it and take it all in and not just skim read it, or if you're lucky, read any of it and things like that. I think, you know, I mentioned earlier the importance of kind of middle managers and managers that people relate to. You know, not saying the senior leaders don't have a role to play, but I think, you know, those people who are much closer to the frontline staff have a really important role to play with change, and they're often neglected when it comes to this. You know, so you know, I think the face to face or even face to face on Teams is, you know, a really powerful way of helping change happen. And quite often those middle managers are a bit neglected, and they're the ones who can really help drive that change. You know, they might be sent all the stuff, but then you're relying on them reading it, interpreting it right. You know, they're busy as it was. So, you know, yeah, focusing on them and what you want them to help you do, and how they can do that in their style, helping them to do that, I think is really important.
Brilliant. Thank you. Thank you. So we do have a couple of others. So one here from Ben, which is about which is the best way to sell management on the East framework, which is one of my favorites, I have to say. Are there more published examples we could point to, maybe some case studies published somewhere?
Yes, there are. There are lots of case studies within the Behavioural Insight team. They've got guidance on using East, which is in the slides that people will get. So you can have a look at that, or just Google BIT East, and you'll find it. I'm trying to think how many of those are kind of internal comms and change. There's probably not that many. But I think there are some.
Yeah, there are some. The other thing you can try, Ben, it's something that I used to do, is rather than tell them, show them. So without them realizing, take them through a process where you've put East into practice and see how they felt about it. Because I think once you kind of experience behavior change in the wild, you're more likely to kind of understand why people do the things that they could do. So it might be things like, you know, walk in a specific way. We did this in one of our buildings, around the building, and how you use East to kind of encourage people to adopt those new behaviours rather than, you know, kind of walk the other way. So just think of maybe one thing that you want management to do and apply either COMBI or the East framework to that. And so they can actually see for themselves how it kind of really works. But yeah, we can get you some case studies as well. Hopefully that's answered your question. All right, Shamira. So I'm currently working with a medical school who are going through a lot of change, and a lot of bad internal comms has been communicated. Staff feel demotivated, and it feels as though they can't be bothered to listen anymore. How would you suggest approaching this kind of behaviour? Well, you can get in touch with Howard and I, and we can come in and fix it for you. But like just briefly, so Russell, is there anything you could suggest maybe?
So I'd say, first of all, trying to get a bit more of an understanding around what's causing that demotivation, because it's easy to jump to assumptions, and you know, so a little bit of research and insight would help, and maybe that would help understand as well what might help people move on from that. But again, it's kind of repeating my other thing, but I would suggest working with some of the people they work with, getting some champions on board, you know, getting them to understand, you know, the changes that they need to understand, and yeah, working with them to develop some good internal comms and engagement opportunities, really, so they can really be on board with your messaging.
Yeah, I'm just going to add something else to that as well, actually, because it's a theme that we're seeing kind of, well, across the country, across the world at the moment. There's a lot going on in the world at the moment, and we don't necessarily drop that when we go into the workplace. We're carrying quite a lot of emotional load at the moment. And then on top of that, we have multiple overlapping changes, you know, kind of all happening at the same time. And I literally don't have time to recover from one change before the next one is put on me. And so I think understanding more about, less about getting your change done so we can kind of get that ticked off, but thinking about how we manage and support people through change, because I think it's a well-being issue as well if you look at the numbers that are off with stress, and change is a cause of that. And yes, comms is a part of that, but the other part of it is how we involve people, how we listen to their concerns, how we are not necessarily not opening that can of worms, as it would be to say. So I think it's not just that particular change that you're working on, but thinking about kind of everything else that's coming at the moment, and thinking about the interventions that you can have to sort that. Thank you. Hope that's been helpful. Eduvier. So Eduvier wants some tips on how to increase response rates to employee surveys where change fatigue or fear of not seeing results could be a cause. My guess, so that's your guess. Again, Eduvier, bring Howard and I, and we'll come and fix this for you. But seriously, I mean, go on, you go, and then we'll talk about surveys. I think we covered surveys a little bit, didn't we? But is there anything else you want to add, Russell?
I mean, I think there is something around telling the stories of what's changed and and trying to highlight benefits for staff, isn't there? That's and doing that. I think storytelling is quite a key tool for this, to try and build some of that confidence, and doing storytelling well, and maybe getting, not just relying on people reading your stories, but whether that is having managers with the tools to tell the story for you, or whether it is being a bit more creative about the ways in which you tell those stories.
Thank you. I'm going to add another one, Eduvier, which you may not like, and I think you need to stop surveying people. I think we survey people way too much. We kind of keep asking them, and they're not doing anything about it. So think about, for surveys, whether a survey is actually something that you need, or whether there's another intervention that you can have. Lots of different ways of listening. But if you do have to do the survey, then think about things like EAST and COM-B, making it easy, reducing friction, talking about, as Russell says, kind of sharing the outputs of any work that you've already done. Hopefully that's helpful.
If I can just come back in on that as well, and just also just co-produce as well. So involve staff in work groups or whatever that are dealing with the feedback from the staff surveys, and putting help them develop solutions to some of the issues that come up, and that's a really key point. Yeah.
Brilliant, thank you. So Russ, we've got 2 or 3 minutes. So do you want to kind of close this out a little bit?
Yeah, sure. So as we've kind of hinted at, there are other ways that we can help you build on this today. If there is any interest, we'd be more than happy to provide one-to-one support, sounding board, or any help applying these tools, and our contact details are there. So please do get in touch. We can also run much more detailed, tailored team training sessions, so where we can design a session around your team's challenges, or around the change programs that you're working on. And finally, in a few weeks, we're going to be launching the first of a 3-part, 3-morning workshop, where small groups will have a chance to apply behavioural science to real examples from your workplace. We'll be sending out details of that shortly. But as a special thank you for joining this webinar, there are some limited spaces where you'll get early access and a discounted place at those sessions. So yeah, if you're interested, there's some ways you can get more into this. Anne-Marie.
There's a bit of behavioural science in practice there, but we can't pull the curtain back too much, can we, Russell? So look, we're pretty much almost at the hour, but I just wanted to thank everyone for joining. I know our days are really busy, but we do hope that you found this interesting. We will be sending out the recording after this call, and as Russ said, just follow either of us on LinkedIn and connect with us, because that's kind of where we share more insight. But for now, thank you very much, and enjoy the rest of your day. Thank you.
Thank you, everyone.